Assalamu alaikum everyone. My name is Dr. Mohammed Adil. I'm a third year psychiatry resident at HMC Qatar. On behalf of the mental health services, we would like to provide some mental health support to our fellow colleagues who are already doing a fantastic job. Doctors, nurses, residents, allied health, ambulance drivers. We just want to provide some tips and advice which have been compiled from different agencies, including the WHO. The very first and foremost, most important advice is that in this time of crisis, it is perfectly normal to feel anxious, stressed, scared during this crisis. Feeling this way is an experience that you are most likely going through right now. You may even feel that you're not doing a good enough job and that the expectations from you have increased. You are right. This first ever coronavirus pandemic has placed consequential strain on our healthcare resources, and we are confident that our fellow colleagues will not be defeated by this virus. Number two, stress is by no means a reflection that you cannot do your job or that you are weak, even if you feel that way. In fact, stress can be useful. Right now, the feelings of stress may be keeping you going at your work, maybe keeping you going at your job and providing you a sense of purpose, a sense of focus. Managing your stress and psychosocial well-being during this time is as important as managing your physical health. This brings to number three, is that it is very important that you take care of your basic needs and you take on helpful coping mechanisms or strategies, such as ensuring sufficient rest during work or between shifts, between on-calls, having sufficient sleep to revitalize yourself, eating healthy, eating a lot of fruits and vegetables, engaging in physical activity, and also keeping in touch with family and friends by social media, phone calls, emails, and so on. It is very important that we avoid unhelpful coping strategies such as tobacco, alcohol, or other recreational products. In the long term, these can worsen our mental and physical well-being. And remember, using the strategies that you have used in the past to manage times of stress can benefit you now. Number four, if your stress worsens, if you start to feel overwhelmed, irritable, tensed, hypervigilant, or exhausted, or even you may have unexplained somatic or physical complaints such as body aches, stomach aches, you are not to blame. Everyone experiences stress and copes with it differently. Talking to people you trust definitely will help, inshallah. And if the stress becomes out of control, please approach your line manager. If you're a resident, please approach your chief resident to ensure you are provided with appropriate support. There is also a COVID-19 mental health helpline available daily from 8 a.m. to 8 p.m. It is the 55734850. Again, it is 55734850. Number five, unfortunately, some healthcare workers may experience ostracization by the community due to stigma. This can make an already challenging situation far more difficult. Thanks God, alhamdulillah, in the state of Qatar, the Ministry of Public Health has been a major actor in combating stigma associated with COVID-19, with multiple sensitizing campaigns to the general public. But as you know, COVID-19 is a new virus. It is shrouded in mystery, and this feeling of fear of the unknown in general public will need some time to dissipate. We would like to end on a positive note. The majority of us will get better. The healthcare community has faced similar outbreaks in the past, Ebola, avian flu among others, and we have come out of it victorious. At this moment, sharing resources, experiences, and lessons, regardless of who we are, is our only chance to win. Thank you very much for your attention.